So as always, if you would like CME, put your your name and the sessions you've attended to this covidcme.dhhs.gov. Maine.gov. Geez, sorry, I haven't had my coffee yet. And I saw somebody, one of my colleagues here, put that in the chat. Also, several folks have asked, geez, I haven't got anything yet. Just to let you know, we're sort of doing it by the month. So we have now sent the Maine Medical Association, who's helping us with this, the names of folks who have attended. I'm sure there are some gaps. So if there are, you can straighten it out with the staff at the MMA. They will be sending you an evaluation form, which is required for CME. You must complete evaluation in order to get your CME. So if you would go ahead and do that, and then I believe it'll come from Gail Began sometime soon. We do not have any financial relationships to disclose. We're going to continue talking about some of the continued vaccine developments today, based always on the prioritization, and then talk about the health alert that went out from Maine CDC in the last week or so. So we've been talking in past sessions about the different kinds of vaccines that have come out. We noted that there was a new one likely coming out soon, one of the viral vectors. I'll talk about that more in just a minute. And then the other exciting news in this past week was also a press release from Novovax, which is creating a protein-based vaccine as well. We talked several times about the similarities and differences between Pfizer and Moderna, so I'm not going to go through those. Soon, we're going to have a slide that shows the similarities and differences, hopefully with one or more of the newer vaccines. So on Thursday or Friday last week, the two manufacturers, so Johnson & Johnson's Janssen division, released their top-line report, a press release of the high-level results of their phase 3 clinical trial for their viral vector vaccine, which we've talked about before. Dr. Sears went through a bit, an attenuated adenovirus, which enters cells and then, again, sort of tricks the cell into making spike protein and then the antibody response. So similar, but somewhat different from the mRNA. Then, interestingly, I mentioned Novovax has similarly put out a press release with their new protein-based vaccine. So from recombinant DNA, creating the spike protein and then injecting that and then triggering the body to create an immune response. Neither one have gone to the FDA yet, but there's an expectation that one and potentially both will soon for review for emergency use authorization. So as soon as we have that, we'll add more specifics in terms of the vaccine's efficacy and safety. You've probably seen some headline results that the efficacy for the J&J, which seems to be a little further along, is not quite the same as the mRNA vaccines, but still a very respectable response. I believe it's about 74, 79%. And as the viral variants continue to dramatically expand across the world, there's really a lot of interest about potentially getting that out. It also is a single dose and no special temperature requirement, so it makes it much more manageable when getting it out to a wide number of people. So again, a heads up and more to come soon, neither one, anywhere near actually being, getting into arms quite yet, but hopefully soon. So with that, I'm going to shift gears a bit to talk about, people have often said, well, what about now that folks are getting fully vaccinated? Are there any changes? Can we stop doing this or that? So I'm going to turn it to Dr. Siri Bennett to talk about a few changes that have been announced through the Maine CDC's Health Alert Network update about a week ago, I think, right, Siri? Or maybe just about a week ago. So this does not have all the information there. It does have the link, but Siri, I'll turn it to you to talk specifically about the vaccine implications particularly.
Right. Yes, good morning. We wanted to acknowledge that there are changes in quarantine and testing now that the vaccine is coming out. It's really important to acknowledge that, in fact, there are positive implications to getting a vaccine. Not only may it save your life, but there are going to be other benefits as well. We particularly wanted to address quarantine and post-exposure testing, particularly because we've got a lot of people in congregate living settings, group homes, and so on, who are getting vaccination and then want to know what to do. Basically, this is assuming that people who are being tested for COVID are being tested according to Maine CDC guidance that has been put out previously, i.e. that people who are being tested, again, I'm switching back to the testing mode here, have either been exposed to a confirmed case or have symptoms. We're not talking about people who just decided to get tested because they're the worried well and may not have been exposed. For quarantine, we've said that if you have completed your 2-dose series and it's been more than 14 days, you do not need to quarantine if you are identified as a close contact of a confirmed case. You're also not required to be retested for COVID unless, of course, you develop new symptoms further down the track. Now, at the moment, we're sticking to a 90-day period. Sorry, it gets really complicated, so I may not be expressing myself clearly. So far, federal CDC has also said that you don't need to be retested if it's within a 90-day period from your last, say, if you are a positive case. I want the caveat to all of this is that if licensed healthcare facilities, whether it's hospitals or long-term care facilities, if you are licensed and have to meet CMS requirements, CMS, you will be judged according to the CMS standards, and they are currently following federal CDC standards, which means that it's some of these rules do not apply. But in general, for people out in the for the rest of Maine, if you are not part of a licensed healthcare facility, we are not requiring you to quarantine if you are been exposed to a case, nor do you need to get tested unless you develop new symptoms. The question has come up around travelers. That decision regarding travel is made by the governor's office. And so we just need to refer back to her executive orders. I think that's sort of the summary. I know there are, as Lisa, you noted, the link is on the slide where you can get that update to answer some of the common questions that we've been getting, that on the Maine CDC website.
Lisa, you're
Thank you,
muted.
Siri. Yeah, thank you, Siri. Thanks so much for joining. And it might have been my computer, but your voice was just a little chopped up at the end. Did you say that the frequently asked questions for this HAN have also been posted to the CDC website?
Does answer some of the frequent questions. Morning, we were finalizing it last night.
Okay, it broke up a little bit again. I think you said you're finalizing it. It will be posted later this morning, I think.
If that helps.
Okay. Okay, great. Now, I know there are also lots of questions about the HANA implications for schools and testing. That was not intended to be the primary purpose. We were going to focus on the vaccine, but certainly I think, Siri, if you're around to stay for questions at the end, we can certainly take some as those come up. Just wanted to reiterate briefly that we are still in phase 1B, which is, or excuse me, anybody in 1A that has not been, but we moved on to 1B about week ago, so it's still 70 years and older. I know on the website, on the CDC website, it lists these others, but we're not to these others yet. It is squarely still 70 and older. Updates are posted to the governor's website. We are over 153,000 doses in arms, which is fantastic. The additional information on where to go is down at the bottom, and then again, over 40 or so sites. That list is continues to grow. I know there's still challenges in terms of how people, actually get vaccines appointments because numbers are so limited. But I'll continue to do the best everybody can while supply is limited, and hopefully, maybe even with some of these new vaccines, we'll be seeing more numbers sometime soon. With that, I wanted to shift gears just a bit again to talk about the importance of ensuring racial ethnic equity. And I couldn't see up front, is Liana on? Amy, can you see, or Liana, are you on?
I am on, but I have got very choppy reception going on over here.
Okay, I'm hearing you fine now.
Okay.
So why don't you start? And if it gets bad, I'll just jump in behind you. How's that?
Sure thing. So for many of you who may have been on Thursday's call with the CDC, but I wanted to reiterate what we're finding with race and ethnicity data
Hey,
for
Liana,
Yeah.
can I interrupt just 1 second to introduce you? I'm sorry, I just jumped right
Sure
in and asked
thing.
if you were on. So Liana Amaya is, and I get the title wrong every time, sorry, Director of, you say your title, sorry. Not everybody might know you, sorry.
No problem. I manage diversity, equity, and inclusion for the Department of Health and Human Services.
Thank you, sorry. Go
My
ahead.
pleasure. So we've begun to see early data. As many of you may have seen, the CDC has now posted a dashboard which demonstrates the amount of folks who have received vaccine, both first and second dose, and does break it down by demographic categories such as age, gender, race, and ethnicity. And many of these categories are in fact required to be reported upon to the CDC and to be asked of each patient receiving a vaccination. What is unique about race and ethnicity data is that the patient is not required to answer it. It is an optional field. And so we always see somewhat of a gap in reporting for race and ethnicity, but we are finding an even larger gap with vaccination. Some of that we think is an error in that some hospital systems have not uploaded that and misinterpreted that data as optional for reporting into impact, which was in error. And I know our CDC team is working with those providers to make sure that they can fix that data and we can have more accurate data. But we were reporting almost 40% of that data missing, which is probably higher than the amount of folks who chose not to answer the question, and much more about a reporting issue. So working very hard to encourage systems to do some self-audit and re-enter that data retroactively so that we can have a better assessment of how much we are really reaching racial and ethnic minorities in the state with vaccination, and better plan to ensure equity in distribution. One of the things that what we're really trying to help with is how do we talk to patients about race and ethnicity questions? We received a number of questions asking, well, our patients don't seem comfortable answering it, and how do we follow up when someone says, do I really have to tell you my race and ethnicity? And we have a couple of suggestions. One is to be very clear, to be able to say, the reason that we ask this isn't going to change the care that you receive. It's really because we care about equity. We know that COVID-19 has not impacted every community the same, and we want to make sure that in rolling out the vaccine, we're reaching all communities. So we need to ask in order to know. And in order to create strategies to reach other communities, we need to understand where we are falling short. So it's really about holding us as a state and us as providers accountable to serving all Mainers. One of the questions that comes up quite a bit is, what is the difference between race and ethnicity questions? And so preparing your frontline staff who are helping with registration to be able to answer the difference. The reality is these are not categories that probably are the way we define ourselves, and acknowledging that up front, but acknowledging that these are the categories that help us to compare data across a number of other indicators and help us to have a good assessment of really where the vaccine is going. Training folks to understand the difference between the two questions and feel comfortable answering this is really key, as is having an answer to what happens to that information. Race and ethnicity data, as you well know, is held in confidence the same way other medical information is. And while IMPACT is a public system, those who have access to it are largely members of our medical field who have an oath, who take a professional oath not to use this data, right, in certain ways. So being able to answer the question about privacy and the questions about why are really important to getting folks comfortable with answering this question so that we can really assess where we stand. Lisa, I don't know if you wanted me to add anything else.
So I just have the slide up that we're going to have. So this was just sort of teeing it up, making folks aware that this is an issue, one we really need to keep working on. But we're going to have a longer session using our monthly DHHS equity webinar on Wednesday, February 17th from 7:30 to 8:30 in the morning. We're not going to hold this Tuesday session that week because we realized 2 sessions in 1 week is probably too much for folks who can join at 7:30. So please mark your calendars to shift this attendance to Wednesday that week. We've been holding a hour-long monthly webinar. We had to skip it last month, but where we will focus on these issues about how to ask, what are the proper techniques, best practices, et cetera. And we will hold the Friday one of these sessions that week, but as we'll skip the Tuesday to try to encourage people to join the Wednesday. We also have some tools. I've got a screenshot of a tool that Leanna's been working on, and also partnering through the vaccine equitable distribution and uptake work group, some community outreach sessions. And we've also trying to organize a speakers bureau to have clinicians available for that to go out into community meetings, be they virtual or in person, to be able to have conversations and build people's confidence and knowledge of the vaccines. Maine Care is also doing some outreach right now with letters to all their members. There may be some telephonic as well, really trying to encourage all populations to understand enough about the vaccine to make a decision about it. And then the state's also partnering with and are planning to partner with the area agencies on aging and various community groups to conduct outreach. A lot of them are doing that already in terms of doing outreach, assisting with transportation. There's been some great stories in the press in the last week about the various AAAs around the state really doing some invaluable work with the 70 and older group. So with that, we'll wrap. I just wanted to flag again a great resource in terms of available resources from the CDC, a clinical resource that any clinician can access. Dr. Madden noted this last time. As always, we've got links and copies of this presentation and recordings from each week on the CDC website. So with that, I will stop sharing and turn it over to all of you and encourage all of those on the call and our clinical work group members to jump in with any answers as we all keep learning together. So, Amy, do you want to tee up?
Yep, there's a few about the HAN and more about does the new quarantine guidance apply to residential care facilities? And I think Dr. Bennett, you answered that, but you can answer it again.
Yes, I suspect it will continue to come up. Yeah, unless you are actually licensed, and have to comply with CMS regulations, yes, the new guidance can apply to you.
There's been questions from folks in long-term care and residential facilities. Once the residents have been fully vaccinated after 2 weeks, there's been questions of whether or not they can go to see their families or have a meal outside the facility with families. What's your guidance to residents who have been fully vaccinated?
The vaccine does mean that you do have some protection. We are still asking people to maintain the physical distancing, to wear masks, to avoid big gatherings and so on, because there's so many people have not been vaccinated. And I think that there's no clear guidance. I would say caution, and I think it will depend a bit on the long-term care, the facility, the residential home, and what policy that home wants to apply. The other thing to take into consideration, have family members been vaccinated yet? We don't know a lot about the vaccine in terms of the ability to transmit asymptomatic infection. No vaccine is perfect, and so you still will get some infections. The intent of the vaccine is actually to reduce the severity of illness if you do get infected. So I still think there needs to be a lot of caution and awareness about, what the risks are.
I'll also just jump in on these long-term care questions. We normally hold a educational webinar like this every Tuesday at 11 a.m. for long-term care medical directors and clinicians. Unfortunately, we've had to cancel today's because there's a lot of state folks involved, but we'll get back at it next Tuesday at 11. And we have lots more folks from Division of Licensing and Regulation who are also experts on, what CMS requires, et cetera, in terms of both testing and quarantine and all sorts of things. So if anyone is interested, feel free. If you're not on that, that invite already, feel free to just email me and I'd be happy to add you to it. We're actually going to specifically cover these issues and recent guidance about updates from Maine DHHS related to surveillance testing and long-term care on the call next week. So feel free.
Okay, so that answers sort of the testing question. You'll address it next week. We've been told that titers such as MMR, varicella can't be drawn until 4 weeks post-COVID vaccine. Is that accurate?
Oh, Dr. Penoyer, that looks like a question for you.
Lisa,
Oh,
I haven't seen anything that says that that is an issue. So you shouldn't have any interference with any of your other titers when you measure these. I've seen nothing in any of the CDC or in any of the medical literature on this. Certainly you want to avoid vaccination within a 14-day window of your COVID vaccination program. But I am unaware. I don't think that is an actual issue. Does anyone else know anything or have heard anything?
Hearing none. I'm not sure if the writer of that question, if there's a specific place where you saw that or have been told. We'd be happy to track that down if you've got a more specific reference. Hi. I also saw a question about the info sheet on race ethnicity. Where is that posted? Leanna, I think that's not posted yet, right? I just did a screenshot of the draft you had sent me, but Leanna.
That's right. I'm finalizing that draft, but it should be available probably in the next day or two, and I'll make sure to send that around.
And where would that typically be posted? Would that be?
I'm working with our team to see if we can get it onto the FAQs on our website, but I'll update you once I have a final answer there.
Okay, so the governor's vaccine website is really the place where we're trying to push people most, right, for information.
Dr. Bennett, this is another one for you around testing. Can you explain the rationale for new guidance to test close contacts immediately and 5 to 7 days after exposure? Are testing sites able to accommodate this new guidance?
I'm not sure that I can speak to the testing sites, but the federal CDC has expanded their guidance. They really are pushing to more quickly identify new cases who may be asymptomatic. And so they issued new guidance on January 21st that states that depending on case burden and available resources, close contacts should be tested immediately after identification as a contact, and if negative, should be tested again about 5 to 7 days after last exposure. So they're trying to more quickly identify people who may be asymptomatic and infected. So because a lot of people who are close contacts, you're told you're a close contact, you may or may not know who that close contact was. It could have been 5 days ago, in which case you could still be harboring the virus. So instead of waiting another 5 days, let's just get tested, see if you've got it. If it's negative, then test again in 5 days.
I did put
thank you.
the link for the registration for February 17th into the chat box in case people are looking for that.
Thank you. Yeah, and I was just going to add, it's the same link. It's just my Zoom link, so it's the same. It asks you to register in advance, but if you get stuck, you could use the same one that we're on now. I believe, right, Amy? It just works for my same personal Zoom link, so either one should be fine. Other questions and/or updates from anybody on the group? How things have been going in your communities? Questions, concerns? Okay, well, we are pretty much at the end of the half hour. hour. So with that, I will say thank you again, Dr. Bennett, for joining, all the members of our work group and everybody for jumping in on this snowy day. We'll be back next Tuesday, the 9th, but again, we're going to skip the 16th and encourage everybody to join on the 17th. That one will be for an hour. So thanks, everybody. Happy shoveling, and we'll see you next week.